because it affects the brain so badly. And the sphenoids and occiput are out. Oh, and he has a hump. With him, it's not so obvious, maybe, but some people it's more obvious. You ever see this big hump at the bottom of the neck? We call it the hump pattern in KST. And actually, my wife had a worse one than this, and it disappeared in 3 weeks. I don't know of any technique that gets rid of humps. And the key is not adjusting the vertebra. Yes, you do adjust the vertebra, but it's not just the vertebra. So far, let's see what's going on here. Oh, and you worry all the time. How do I know that? Both temporals are anterior. Temporals are bilateral anterior, an obsessive worrier. What can I tell you? Yeah, I learned about this from when I first started doing this. You ever notice when you first start doing something, the universe sends you the weirdest things? It's like, you know, and I've got it. People have come to KST seminars right after they learn the work. Monday morning, suddenly this bizarre case walks in that they never would have even wanted, you know, attempted, but now they can address it. So what else is going on? Lumbars. Yeah, your lumbars are out. You have disc stuff?
I don't have low back pain, no.
No, but your discs are out. You have a disc issue. Actually, it's more anterior than lateral. There's a disc thing. Yeah. And your lumbars are out. I don't, you know, whether or not you have pain is always secondary. 11 and 12, thoracics, kidneys, adrenals are out of place. And the ribs are out, relating to the kidneys and adrenals. That's enough right now.
Yeah, that's enough.
Does that sound?
Sounds pretty good.
Sort of accurate?
Yes.
All right, so how do you correct the person? With KST, we generally check people, as I said, in the posture of subluxation. It's usually standing or sitting. Sometimes laying down, although that's general. Usually laying down if someone snores. The hyoid is usually out of place. Chronic, lifelong snoring, one little tap of the hyoid, it's gone. But they usually, it works, I do it standing, but it works best if they're laying down because that's the position they sleep in. Most people sleep laying down. I believe
I'm
it.
gonna be truthful, you hit it right on. I have an issue with the kidneys right now.
Okay, well, that's not surprising that T11 and 12 are out, but there might be other things too causing your problems. Oh, okay, I see a biggie. You have root canals?
No.
You have a dental infection? Do you have any weird stuff here, mercury or something?
Might be mercury, because, yeah.
Because I'm getting something right here. There's a dental issue.
Might be mercury.
Now, each tooth is an organ, right? Organs have blood supply and nerve supply. That's the definition of an organ. Every tooth has its own blood supply and nerve supply. Each tooth is an organ. The dentist taught me this, because I work with a lot of dentists now. And they're also related to different organs. So if a person has a particular problem with a certain organ, and you fix the dental problem, a lot of times the organ gets healthy. So yeah, and you got something here. I have not memorized the dental chart, so I can't tell you. Some people have, but I haven't. Maybe I should one day. Okay, I can check you standing. So I'm gonna show you what I do. It's gonna look very simple. What I'm doing is I count areas that need correcting. I'm not gonna do any cracking or twisting. I generally don't use a table. Using this work, you save a fortune in headrest paper. Pay for the seminar. Also, you don't need any fancy equipment. And a lot of doctors have been suckered into buying such expensive crap. Pro adjuster, anyone? $80,000, 70 grand? Oh, and an MRI, 9,000, which is 120,000. I guess I shouldn't give exact names because I'll piss somebody off. But, you know, and I'm not blaming you. If you don't know, then, you know, that's what you do. That's what because you want to get people better, you want to make money, you want to get happy patients. I understand this. But if you can get disc problems cleared out quickly and easily, without any special equipment. I prefer the ArthroStim. There's a lot of adjusting instruments. I think this is the best one. And the inventor of it is here, Ed Miller from Impact. He's got a booth. And it's just amazing. I know there are other instruments out there, and people have brought them and told me about them. Everyone who has tried a few says that's the best. And they last forever. You can drop it, doesn't break. Friends of mine have had those for 10 years or more. So it's great, and the service is excellent. Everybody likes it. And he's very ethical and honest. So let's get back to you, okay? So, you can take off your glasses, just make it easier. Oh, thank you. So, let me see. So what's the priority? Okay, standing is the right posture to check him out. Priority, is it above the waist? Yes. Cranials, yes. Parietal. This old head trauma has never left his body. So let's fix it. Now, when I was studying craniosacral therapy and other kind of cranial things, anybody studied cranial work? SOT cranial and all? How long does it take? Could be a while, right?
Yeah, the matter of fact is, when I got a patient, I'm hoping the cranials are not out because it takes me so long to work on them, it wears me out.
Oh yeah, I know, I've seen it. With this work, you can correct cranials in seconds. In fact, you can do the whole skull in less than a minute. It's that fast. Isn't that accurate? So, okay, right parietal is inferior. There's a bunch of attachments that Ed has, and I like to use this for the parietals because it's a larger bone. That's it. And let me see. It's fine. I work with craniosacral therapists who have studied this work. The craniosacral, I love it. I love craniosacral therapy. I knew John Upledger when he was around. I was one of my heroes, just a marvelous person. But there's craniosacral therapy had a limit. Anybody do craniosacral or no craniosacral therapist now? It's great stuff. I love it. But it's too meningeal based. It doesn't deal with structure. If the structure is out, the meninges will be tight. You can release meningeal tension, but the tension will come back unless the structure is corrected. So once the structure is corrected, the meninges release quickly. Is there probably cranials? More cranials, sphenoids and occiput. So that's powerful. The sphenoids are out and the occiput. Sphenoids are cool. When I was 19 years old, I worked in a nursing home in Miami. We lived in Miami at that time. And and there was one ward where all the people going to die were in. And they were like curled up in a fetal position and with the bubbling oxygen and all, you know? And I noticed the sides were sunken in. I didn't know what the hell it was. I just noticed it on people. Years later, I read something, I think, by Desjardins, who said a sunken sphenoid is a sign of life energy leaving the person. Isn't that wild? Or a sign of lack of life energy. So sphenoids are like, and I remember seeing a friend of mine who just had the flu, and it was sunken in here. And you know, a week or so later it came out, but I thought, that's really cool. Sphenoids are very powerful. The whole front of the brain sits in them. So his are out. What do? You fix it. His sphenoid's anterior. Now this one sphenoid bone has two wings, goes out on the right and left side. So, how'd that feel?
Good.
Yeah, you don't really feel much. It's not the amount of force, it's the direction. Occiput is inferior. Yeah, it was his sphenoids were anterior, occiput inferior. Ooh, his occiput is also lateral. That means more of a chronic problem. So let's fix the laterality too. Sensitive there? Okay, priority cranials. Okay, temporals are also jammed up. So what I'm doing is fixing this cranial bone. But you notice it's fast, it's easy. No cracking, twisting, no real force. And the instrument toggles at about 12 times a second, which is, they say it's a healing frequency, a harmonic of the Schumann. People are into that stuff. Okay, so their priority, above the waist, below the waist, lumbar, sacrum, coccyx. Oh, right, the pubic bones are inferior. You ever have SI pain? Sacroiliac? When you're sitting, or going from sitting to standing?
It's not chronic, every once in a while.
Okay. Anytime you have a patient with SI, look to the pubic bones. The biggest problem is doctors look where the pain is. Don't do that. Look where the cause is. If the person has SI problems, pubic bones are usually inferior. Sometimes superior. Do you get inferior, superior? You know? Yeah, and it's amazing. And you don't even adjust the pubic bone, you just above it, because you're not going to go right on the bone. Just above it, and pains go away. I learned about it from a pregnant patient. Horrible SI pain. And no, she had been pregnant. She had severe SI pain for 7 or 8 years since her last pregnancy. Just horrible. And I'm checking her, I just started this stuff, and her pubic was inferior, so I tapped it, and she started to cry. Oh shit, what do I do? I said, are you okay? She says, yeah, my pain just disappeared. I said, I've had it for years. It just went away. Just the pubic bone. So this is, and I didn't discover it by reading anatomy books and trying to figure things out. I just asked the body. You'll find the body has a lot of wisdom. So, okay, pubic bone. Feel funny?
It's okay.
Huh?
It's all right.
Oh, all right. Because I'm tired. Okay, pubic bone's cool. Is there a priority? Above the waist, below the sternum. Sternum is big. It's out in 2 directions. It's up, superior and lateral. Superior sternum. This is your shield. It's raised up. You're in panic. You had some kind of fright. Your shield is up to protect you. And that's normal and natural. He had a fight or flight situation, something freaked him out, and that happens to all of us, but he didn't let it go. So he's still in a slight state of being on guard. And it's also, his sternum is lateral. Lateral sternum is associated with heart palpitations, atrial fibrillation, skipped beats, tightness in the chest, chest pains, breathing problems, all from a lateral sternum. So let me see, what do I do first? Lateral first. Yep, whole sternum is lateral. Cool. See, people have layers. I'm doing it in the order the body wants it done. Sensitive there? Yeah. That's sensitive, right? Why is it sensitive? Because there is inflammation. Why is there inflammation? It's chronic. What is inflammation supposed to do? Protect us, heal us, keep us healthy. And his body's been struggling because it's not putting it back in place, so the area gets inflamed. And so that's actually a good sign. It means he's alive. It means you're alive.
Good.
Okay, good. Just want to double check. So is there a priority? Cranials. Above the waist, below the sternum. Okay, again, superior sternum. This is the panic pattern. So. Now I could ask him to think about the emotional thing, whatever that's bothering him.
Very tender.
Very tender. Yeah, it's been out of place a long time. So standing, sitting. His body just said, I want to sit down. The sitting posture refers to the subconscious emotionally. Hold on, wait, hold on. Because I want your back exposed. So let me move this. Hold on. There. And if you sit facing that way, that would make it easier.
No, the other way. Oh,
No, it's that way.
okay.
So standing, especially emotionally, standing is the conscious, sitting is the subconscious. So sitting, and it doesn't necessarily mean I'm dealing with subconscious, but it meant that structurally you needed to sit because there's stuff that has to be corrected. If you correct people in only one posture, you might be missing some serious subluxations. And if he's got the same, or a person has the same subluxations, standing and sitting, that means that's great. They'll shake your hand, thanks for the adjustment, sit in the car, and re-subluxate on the drive home. So, okay, the head trauma thing is released. Sphenoids are still out, temporals are still out. Occiput, no, that's good. Mazel tov. So probably cranials. Cranials, just the sphenoids and temporals. You don't ever want to do what we call over-adjusting, because you can actually cause damage. Don't do more than the body wants. Sometimes the body will say, don't touch me. I'm processing, I'm rebooting, I'm thinking. Is there a priority? Above the waist, below the sternum, superior and lateral. I'm sort of doing it much faster than a beginner would do it, which just goes, I've been doing it longer, so. Well, maybe not. Good. Felt weird?
Less tender, but still.
Yeah, it should be less tender because it's been a little corrected. Okay. Ah, the hump. Let's get rid of his hump. What the hell is this? And you see it in a lot of people, don't you? And the hump actually affects the heart, lung, and thyroid. You see the hump in people, it ain't good. People with humps generally have low back problems because their heads are forward. So their low back is struggling to, right, all that stuff. So, okay, the hump is, oh, he's got also counter rotation, T1 and T2. You have upper extremity stuff going on? Arm, shoulders?
A little problem shoulder.
Yeah, how did I know that? T1 and T2 are counter rotated. They're going in opposite directions. That's real pinched nerves. That's what I had for 10 years, my upper extremities. Nobody corrected it. And using diversified, you make it worse. So T1 and T2, should I do that first? Nope. Okay, let me get rid of the hump pattern. This is great, you'll love it. Try it on your patients. It's T1 and T2 superior, T3 and T4 inferior. Talking about the spinous processes, right? Oh, this is fun. Hump. And
The ribs are out.
that's why he has them. Sensitive?
Yes.
Yeah. Humps are caused by the ribs locking up the subluxation. Sensitive there? Which side was worse?
This side.
That side. Usually one side is much more sensitive than the other. When the ribs are twisted, the hump never goes away, no matter how many times you adjust the vertebra. So what do you gotta do? Correct the ribs as well as the vertebra. Then the hump sees up. Beth had one worse than his and went away in 3 weeks. Some doctors have told me humps have practically disappeared in one visit. But every patient's different. Now he has counter rotation, T1 and T2. If it's 3 and 4, I would say he had asthma. You see that in asthmatics a lot, or bronchitis or some kind of pneumonia, whatever, some kind of lung problem. But T1 and T2 is often uploaded. Could be neck problems, because you're dealing with the brachial plexus, that can affect the cervical plexus, and all that fun stuff we like learning in school, right? Sensitive there?
Oh, yeah.
Yeah, and here? Yeah, why is it sensitive? Because he has real nerve impingement. Whenever you have counter rotation, there's real nerve impingement. You'll find counter rotation generally in transitional areas. T1 and T2, L4, L5, L5, S1. Yes, S1 does subluxate. Sometimes T6, T7, not as often, but upper thoracic, lower lumbar. Transitional areas are the weakest in the body. It's just the way our bodies are made. Those areas seem to have the most stress. So what's next? I don't know, I have to ask. See, the whole key is you don't know what you're going to do. You ask the body. The purpose of KST, and this is the one distinguishing factor. It's not the instrument, it's not necessarily putting people in postures, it's asking the body. You humble yourself before the wisdom of the body. Let the body tell you what it wants. You'll get better results. And this is why this can be used with any profession. We have naturopaths, homeopaths, dentists, osteopaths, MDs, all coming to KST seminars, and lay people. Why? Because you can work on yourself, and there's no law against working on yourself. Not yet.
Can you charge yourself?
You can charge yourself, there's a code for that. In fact, we have one lay person who's here at Life, he just graduated. He came to a KST seminar as a vendor. He got turned on to it, and he was learning KST before he was a chiropractic student. And he got so inspired, he entered Life College, he just graduated a few days ago. So I think there's five chiropractors now that came in just as lay people. And so people say, you shouldn't let lay people learn this work. I say, bullshit. Let anybody learn it. And you can go on the YouTube and watch brain surgery, for God's sake. Doesn't mean you're gonna be a brain surgeon. So yeah, anybody can, I said anybody can learn this work. Whether or not you can charge for it is always dependent on the jurisdiction in the country, the states, the land, whatever you live in. I said, don't get in trouble, but there's no law against working on yourself or your family members. And we've had elderly people actually come just so they can take care of their grandchildren. And they know that once, there's a serious thing, they tend to go to chiropractors. So it really does improve our profession. And it shows we're not selfish in trying to be a little clan, that we know that what we have is a universal healing principle that can help everybody. Okay, what's next? Sitting, standing, processing. He's processing. I didn't get a yes or a no, I got a yes for processing. So I can check you later. Okay, right now, so you can have a seat.
All right.
Here you go.